Welcome back. To complete our discussion talking about cervical cancer, joining me again is Dr. Eric Wallace, Associate Professor, Internal Medicine, the University of Oklahoma School of Community Medicine, and OU Physicians in Tulsa. And I will say one more time on this segment, we do have construction happening outside, so if people hear a lot of extra noise, that is what that background noise is all about.
Okay.
This is blowing me away, Doctor, I must say. Let me ask a few more questions in reference to cervical cancer. Are there certain age, racial groups or of women who might be more prone to the development of cervical cancer than others?
Yeah, and I think the same thing applies with cervical cancer as it does breast cancer, where there's a lot of genetic factors we don't fully understand behind the development. You know, of those who get the dangerous strains of HPV virus, who's more likely to develop into cervical cancer? Who's more likely to get it versus not get it? So there's a lot of questions there we don't understand. But if you look at the number of women who die each year from cervical cancer, which is not a big number anymore because so many women get pap smears. We've dramatically reduced the number of deaths from pap smears. The reason we still have deaths from pap smears is mostly due to the fact that women don't get their pap smears done. So 50% of women who die from cervical cancer each year never had a pap smear.
Okay. Is that related possibly to the insurance issue as far as accessibility to health care? Do they know? Is that one of maybe the main factors that the women have never had a pap smear?
Right, so there certainly may be some fear on the part of women about even getting a pap smear and what it entails. But yeah, not having access to a physician and access to getting pap smears certainly plays a part in those pretty disturbing numbers. So if we do a better job of reaching out to those women who meet criteria for pap smears and actually get them to do their pap smears on a regular basis, we can further decrease the amount of women who develop cervical cancer.
Okay, now in terms of, you talked about those recommendations of 20, that's still blowing me away, 21 to 29 every 2 years and 30 to about 65 every 3 years, but depending on other kinds of factors. If you kind of look at those particular recommendations, are certain populations who are going longer than the 3 years also prone? You mentioned about women who never get pap smears, but let's say there's a woman who hasn't gone for a pap smear 6, 7, 8, 9, 10 years. Is that really significantly increasing the possibility of the development and lack of detection?
Well, absolutely, because if you've gone beyond that 3-year interval, there's a chance you may have had some precancerous cells developing, and because you haven't detected them at an early stage, as those years go on, they're more likely to develop into something that could lead to cervical cancer. So as you go more and more years beyond the point of when you got your last pap smear, beyond that 3-year time period, yes, it does increase your risk of developing cervical cancer.
Well, now, are there symptoms? We haven't talked about that. Are there symptoms signs or symptoms that the woman can pick up on to know that she may have cervical cancer, especially if there's the person who's gone a long period of time? Are there going to be any changes, pain, discharge, anything like that the woman can sort of key in on?
In the early stages of that precancerous development, generally no. It's relatively asymptomatic. You don't know that those cancer cells are starting to develop at that very early stage. That's why the pap smear is so useful. You can detect those cells and undergo some pretty easy treatment to get rid of those cells if they are detected.
Okay.
Now, if you start to develop symptoms, it's more likely you've gotten to a more advanced stage, where if you start to have bleeding or painful sexual intercourse, you may have already developed a cervical cancer at that point. Okay. So that's the other part about doing a screening test, is you're doing it in people who are relatively asymptomatic. They don't have any symptoms of cervical cancer. The goal is to catch it in an early stage before they have symptoms, before it spreads and causes additional problems.
Okay, now let's say a cervical cancer is detected early, and there are the procedures you're saying that you may be able to take care of that. Does that, once you go through that process, does it mean that the woman now is going to get more frequent pap smears, maybe every few months or for a year or two, or how does that work?
It depends on what you find. So if you catch it at an early stage and you undergo a procedure called a colposcopy, and that's where an obstetrics gynecology expert will go in and freeze the cervix, and it freezes those abnormal cells and kills them, hopefully leaving a surrounding a healthy cervix with healthy cells and non-precancerous cells. And then you'd need some more close surveillance, perhaps on a yearly basis, until you get perhaps 3 negative pap smears in a row, and then you can space them out to less frequent intervals,
Okay.
say every 3 years. Now, if
Okay.
you have more advanced pathology, if you have a stage of precancerous cells that are more advanced and just below that point of becoming cervical cancer, then you're going to need closer surveillance for a much longer period of time. And the last recommendation state you should probably get yearly pap smears for about a period of 20 years after the surgery that you have to remove those more advanced precancerous cells.
Okay. Let me ask this other question. What about women who undergo a hysterectomy? Do they have the need to follow this recommendation if they're in the 21 to 20 every 2 years or 30 or above every 3 years? Do they have that same need?
For the most part, no. Most women who have hysterectomies have them for non-cancerous reasons. All right, they don't have cervical cancer, they don't have uterine cancer, they don't have precancerous cells in their cervix. They have them for other reasons, like a fibroid or other problems that they're having. So if you have a hysterectomy for what we call benign reasons, non-malignant reasons, then you don't ever need a pap smear again, because your chances of developing cervical cancer are virtually none because you don't have a cervix anymore. That's been taken out. However, if you have a hysterectomy because you have abnormal pap smears, you have precancerous cells, or if you even have cervical cancer, then you do want to continue doing pap smears, because there could be some of those precancerous cells or cancer cells left behind, which could then continue to grow. So you want to make sure you're continuing to do those pap smears on the remaining vaginal wall to make sure those cancer cells are still not there and developing.
Okay, and that's the key, because people may say, well, I thought you said, Doc, the cervix was gone, but what you're saying, it is gone, but if there was some cancer there before, it still may be lurking in the vaginal wall still, and that's what you're actually doing the pap smear on, not on the cervix. It's a whole different.
But only if you've had precancerous or cancerous cells in the past. I meet a lot of women every day who come into my practice who are, of whatever age. Sometimes they're 75, 80 years old, and they're still getting yearly pap smears, and they had their uterus out 30 years ago because they had bleeding fibroids. They didn't need all those pap smears. And they're very happy when I tell them they don't need pap smears anymore. I haven't had anyone object over that.
Okay, and that's one where we'd have to say physician education is really key, because you're following the directives of the physician in that case. But you don't need them if you've had the hysterectomy, unless you've had precancerous cells or cancer, where they may want to follow that a little bit more in the vaginal area.
Yes.
Okay, thank you so much for helping to clarify. And I must say, Doc, I'm still stuck on that yearly pap smear, but I'll think about it.
Okay.
Thank you so much.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalert@gmail.com. And don't forget to also visit me on YouTube at youtube.com/Health Alert USA, and talk to your doctor, give Dr. Wallace a call, and find out what you really need to do. If you have concerns, confusions, questions, please voice those to your provider and get the real skinny, as they say. Take care. This program would not be possible without the support of OU Physicians in Tulsa.